surgery.
And that's why our pre-op program is long and extensive.
So your diet should change, you should start exercising, you should increase your protein, you should start taking your vitamins, start restricting your intake, all of those kinds of things. Get all the bad stuff out of the cupboards, get all the good stuff in, make sure that your family or the significant people around you understand your lifestyle change and are supportive of that.
Most bariatric programs use a multidisciplinary approach to care for patients. Your bariatric team often includes a bariatric surgeon, physician, nurse, psychologist, dietitian, and of course, you.
Okay, great. Thank you.
The entire team helps to build your success and health. Bariatric surgery is a tool for long-term weight loss and requires all aspects of overall wellness. Teresa has been meeting with her bariatric surgeon and his team regularly over the last 6 months to prepare for surgery.
Come on in.
Hi, Dr. Wicker. How are you?
Hi, good morning. Team approach is really the way to do it. It's been shown that in every really significant kind of surgical procedure, the team approach has been shown to be the best.
There is usually, and very importantly, a dietitian, a bariatric team dietitian.
We're going to go through healthy food choices. Do you guys like cereal? Think high fiber, high protein, okay? The thing you have to remember about the ground beef, you gotta get the leanest kind of ground beef.
During the pre-op and post-op process, patients are changing their lifestyle, and most of the time they're changing their lifestyle revolving around food issues.
Okay, well then I would wait to eat at work.
Qualified nursing staff, both in the clinic and in the hospital.
My name is Maria, and I'll be doing your EKG for today.
Okay.
And it's going to measure your heart rate and also if you have any arrhythmia or anything like that.
There's always a medical bariatric intensivist who clears the patient for surgery and also helps the patient make lifestyle changes.
And how about family history, starting with your dad? Any medical problems with dad?
My dad's deceased.
What age?
56.
56.
We have psychologists that know and understand the problems with eating disorders and the problem with morbid obesity.
Okay. This is our Tools for Life session.
And there'll be some issues that the patient will need to deal with, and there's a psychologist on board to help with all of those issues.
We have exercise physiologists.
Relax. I'm going to push my arms out, use my chest, palms down, hands closed.
In addition, we ask that patients join a support group so that patients can meet other patients who've had the surgery, and these patients provide social support for each other. And it's really nice to know that somebody else is going through the same thing that you're going through.
Well, it's finally occurred.
I'm excited.
Here we are. When patients come into my office, they should have a couple of different feelings. They should be excited for the reasons that they want to have surgery, and they should be anxious about it because it's a big operation and it's an operation on them, and so they should have that respect for what's going on.
I think I've prepared myself really well, you know, especially cutting back eating. I'm not hitting the candy machine at work anymore, and everybody at work's really supportive. You know, I had my doubts about it in the beginning, and you know, as if everything, you know, you worry, but I think I'm ready.
Coming up next, what can you expect as the day of surgery unfolds?
You should be comfortable. If you're not comfortable, let them know, because that, you know, it really is an anxiety-producing experience sometimes if you don't know what to expect. There are some nerves involved with this, aren't there?
I'm, yeah, very nervous.
Yeah.
I didn't sleep very well last night. What do I really expect on the day of surgery?
Yeah, the day of surgery is kind of...
The time has come. You have worked with your physician, bariatric surgeon, and other members of the healthcare team leading up to the surgery.
The team approach is really very important for these kinds of things.
And now it's time to move forward with surgery. Your surgeon will give you information on how to prepare.
So then it takes about 20 minutes, sometimes 30, to get you all ready for surgery.
Like any surgery, there are common guidelines to help you get ready. Arrive at the hospital early.
You'd come into the hospital at the prescribed time.
I'm a little nervous.
We give everybody a blood thinner, an anticoagulant. They have to get that a couple hours ahead of time.
When you go to the hospital, wear comfortable shoes and clothing that's easy to put on when you are ready to go home. Also, don't eat or drink anything starting the night before the surgery.
And so just kind of full liquids the day before. That's the process.
Speak with your physician about medications you may be taking to determine if you should take them prior to surgery.
You usually take those in the morning?
I do, yeah.
Okay, so take that dose the night before.
Bring someone with you who can make healthcare decisions for you while you are under general anesthesia.
The significant other or family member or whoever comes along, you'll be able to come along with her right to the holding area.
Bring your CPAP machine, if you use one, for your stay in the hospital.
Come on in here, have a seat.
Like any surgery, there will be normal procedures after arriving at the hospital.
Preference that's better for you?
Right.
Okay, good.
You will see many members of the healthcare team.
Good.
You will change into a hospital gown.
The gown is going with the open side of your back. This is the open side in your front.
Then you're brought to the operating room, to the hold area, the pre-surgical space.
We'll see you in a couple hours.
Yeah, we'll get a couple hours after the surgery for recovery.
You'll be on a gurney at one particular point. The nice thing about it is, most of the time the operating room is pretty cold, so they'll have this warming blanket on you. It's pretty nice.
After this door, sir. I'll see you for sure. Love you too. I'll be right back. Show you to the way. Thank you.
You should be comfortable. If you're not comfortable, let them know, because that, it really is an anxiety-producing experience sometimes if you don't know what to expect, and temperature changes adds to that. So you should be comfortable. We want you to be comfortable. And the anesthesiologist meets with the patient, the operating team usually meets with the patient. Any last-minute kind of questions are answered there. Then the patient is brought back to the operating room. And then the operation itself really starts.
Your healthcare team will have its own instructions for you, so follow those. They know your specific clinical needs.
We don't really try to key in on the operating time. We try to be efficient at all the things that we do. We try not to waste motion and time, but we don't try to be fast. Being speedy is not necessarily a good thing. Being efficient, I think, is an admirable one. And then you'll stay asleep, fully asleep. You will not wake up until we're done with the operation.
Coming up next, see how Nadine LeBlanc has adjusted to her recent surgery and get tips from Abel Kohler, whose surgery 1.5 years ago changed her life. Nadine LeBlanc, an ethnic hairstylist in Los Angeles, California, had bariatric surgery just 2 weeks ago. She's already experiencing positive changes in her body, her weight, and her health.
The main reason I decided to have the bariatric surgery